When we look at testing of individuals, we carry out what are called molecular tests or PCR tests. And this indicates evidence of particles of the virus, parts of the virus in an individual. Having somebody test PCR positive doesn't necessarily mean that they are shedding live virus, that they can actually transmit a live virus to someone else, that they're infectious to somebody else. What we understand from the data coming from labs is that people can be PCR positive, meaning that we can capture fragments of the virus for many weeks, in fact. And it depends on how severe a person is. It depends on how severe their disease is, because you can shed virus, you can have a PCR positivity for many, many weeks. But that doesn't actually mean that you can transmit the virus for that long. What we understand about infectiousness, of when somebody can transmit to others, that comes from trying to isolate the virus or grow the virus from a sample collected from an individual. What we understand, there are a few of these studies that have been conducted, and what you need to do to carry out these studies is follow an individual and test an individual, collect samples over several days from the same individual. What we understand from those results, and these are still preliminary, what we understand is that people we can isolate live virus, which means they can transmit to others just before they develop symptoms, up through the first 8-9 days of their illness. After day 10, it's very difficult to grow the virus. So it appears people are most infectious at or around the time that they develop symptoms, and for the first 5, 6, 7, 8 days of illness. This can be different for individuals who have severe disease. And there's one example of a study that is, I don't know if it's actually published or it's still in preprint, of severe patients who are hospitalized and therefore isolated, that can shed live virus for up to 3 weeks. So it depends on the severity of their illness. But just because somebody is PCR positive for many, many weeks doesn't mean they can actually infect people for that long. So this is what's important. Why we keep saying that it's really important that we carry out active case finding and that we isolate individuals for a set period of time, and we have definitions of how long people should be isolated based on the data that I just provided to you. It's also important that we carry out the contact tracing, and we find those contacts and we quarantine those contacts. This is what breaks chains of transmission.